Childhood obesity. Our group members consist of Kelly Guru doing introduction and background, Madison Hill doing research findings, Brittany Reeve doing media portrayal, Aaron Thompson and Patrick Boone doing interprofessional viewpoints, and everyone doing the conclusion. Obesity is an abnormal accumulation of excessive fat that can negatively influence health status. Childhood obesity is considered a medical condition associated with an unhealthy weight gain in children and adolescents. Weight gain is disproportionate to the changes in height and age. It increases in the likelihood of becoming an obese adult. It also proves an increased risk of developing compromised health because of the medical problems and chronic disease.
To classify a person into a specific weight category, their BMI or body mass index is determined. BMI is one of the most common measures of body fat, and it is a person's weight in kilograms divided by his or her height in meters squared. Although BMI is not actually a direct measure of body fat, it is correlated with other measures such as skin fold thickness and bioelectrical impedance to provide an accurate measurement. As you can see on this slide here, the CDC growth chart for children is provided. This interprets their BMI for age, weight, status. It has been developed by the Center for Disease Control and Prevention and is divided into weight status category and the percentile range associated. So, for someone to be considered of normal or healthy weight for their age and weight status, they would have to be between the 5th percentile to less than the 85th percentile. Conversely, to be classified in the obese category, they would have to be above the 95th percentile for their age and their weight. So now I'm going to talk a little bit about the history of childhood obesity. Childhood obesity in Canada has been steadily on the rise, especially within the last 30 years. From about 1970 to 1972, rates of overweight children were around 9.7%. In 1978, about 15% of children between the ages of 2 to 17 were considered overweight as a result of their BMI. Jumping up to 2004, that number increased to 26%. That's about a 70% increase over 25 years, which is a huge increase. As you can see on this graph, if you look to the far right, you can see that the largest increase in BMI was seen in children from 12 to 17 years old. Their BMI more than doubled in its rates between 1978 and 2004, which is of concern. The consistent increase in obesity of children not only influences their overall health, but also has negative economic effects. In 2005, the total cost of obesity to Canadians was about $4.3 billion. $1.8 billion was spent on indirect healthcare and $2.5 billion on other indirect costs. Unfortunately, this spending probably could have been avoided if we had been able to find a way to fight these preventable obesity rates in the first place. However, over recent decades, there has been an increase in advertising for unhealthy habits, which has been promoting the sedentary lifestyles that children are living on a day-to-day basis. If these trends continue, Canada could see 70% of their adults as overweight or obese by the year 2040. In terms of the epidemiology of childhood obesity, there's currently 1/3 of Canadians between the ages of 5 and 17 that are classified as overweight or obese. 19.8% are overweight, and 11.7% are obese. That works out to be about 1.6 million children in Canada alone. The prevalence between boys and girls differs, though. There are 15% of boys who are overweight or obese, and about 8% of girls who are overweight or obese. The largest difference between boys and girls is seen in children between 5 and 11, where boys are 3 times the percentage of girls in terms of their obesity levels. Socioeconomic status can play a role in the weight gain of children, as statistically, Those with a lower income are more inclined to buy foods that are higher in fat and caloric values. They also have less access to information regarding healthy eating and physical activity and the benefits of either. Processed foods are a commonality in the lives of children, mainly due to busy parents, which makes it easier on their lives, getting bored of what they eat, and being picky between what they will eat and what they won't. This makes it very easy for them to quickly increase their calorie intake. A combination of unhealthy foods and inactivity have caused childhood obesity to skyrocket recently, and it has become a very serious health concern. Some preventative measures towards childhood obesity can include adopting a healthy attitude towards food, being active as a family, encouraging new hobbies that involve physical activity, limiting screen time, acting as a role model, as children tend to mimic what they see, involving the whole family in building better habits, both in terms of eating and in physical activity, buying fewer high-calorie foods such as sugary drinks, cookies, chips, or other unhealthy snacks, increasing the amount of fruits and veggies you buy, and plan and cook healthy meals together, and getting your children involved in the process. So while I have reiterated the fact that childhood obesity is usually linked to physical inactivity, unhealthy eating habits, and an increase in BMI, there are other commonly associated factors that are linked as well. This includes things like genetics, meaning that if one or both of your parents are overweight or obese, your risk is increased. Social influences, meaning that if you spend less time playing outside or playing with your friends and more time on your computer, watching TV, or playing video games, your risk is increased as well. Cultural influences, some places tend to eat healthier foods than others, and some places eat more food than others, and this can be associated with an increase in fat content. Psychological influences, meaning that certain people will eat more if they are depressed, or also if they have a lot of stress in their life. When it comes to diseases and medication, for example, thyroid disease, if somebody has thyroid disease, their risk is going to be increased, and even medication that is associated with certain diseases can cause an increase in the amount of fat that a person has too. So, unfortunately, statistics show that children who are overweight or obese are more likely to develop unhealthy dieting habits or eating disorders, suffer from depression, or even lead towards substance abuse. There is also an increased risk for developing medical problems, including high blood pressure or high cholesterol levels, abnormal blood lipid levels, shortness of breath during activity or at rest, restless or disordered sleeping patterns such as sleep apnea, bone and joint problems, or serious cardiovascular issues leading to heart disease, heart failure, or stroke when they become adults.
Peer-reviewed articles published with current information on the issue of childhood obesity. The work that was available discussed future planning by the Commission on preventing and treating this disease. Obese children are more likely to suffer from obesity-related comorbidities such as hypertension, diabetes, and psychosocial factors. These psychosocial factors could include bullying and or school absence. The World Health Organization has stated that childhood obesity has become a global problem and is not going away on its own. The Commission has been included in the treatment and prevention of childhood obesity. The Commission plans to utilize implementation, monitoring, and accountability to form a program designed to manage childhood obesity. Primary care providers are one of the largest contributors to the potential cure of childhood obesity. Current treatment trends are utilizing drugs to assist in weight loss and maintenance. However, this is not a cure for this health dilemma. It is imperative that starting at young ages we teach children how to manage their weight in a healthy manner to benefit their future in controlling their health. Preventing obesity is a difficult challenge because we need a program that will be suited for all different types of physical fitness levels in children. A program will need to adapt to Canada's current obesity issue to provide a treatment program that will be universal to different children. Considering prevention and treatment together will give Canada a greater chance at success, as it will encourage a simultaneous challenge in maintaining children and adolescent health. This will also give young people the education they require to continue their lives with healthy lifestyle choices. The Commission's responsibilities are the following. Approach and combine interventions most effective in tackling childhood obesity in different contexts around the world. Prevent children and adolescents from developing obesity, and treating pre-existing obesity in children and adolescents. The Commission will then present its report to the World Health Assembly, who will consider the report and hopefully implement the Commission's plan and recommendations into the healthcare system. Our healthcare practitioners will then need to study the report to be able to encourage and utilize the program to the greatest of their abilities to benefit the health of our society. The Commission's report suggests that childhood obesity must be accepted as an urgent and global challenge of major significance to global health and to all countries that require leadership by governments and coordinating action with other actors.
This video is a commercial created by Children's Healthcare of Atlanta portraying the signs of childhood obesity and what needs to be done to prevent your child from becoming obese as an adult. The video starts off with an obese man named Jim being brought into the OR room. The doctor asks, "What do we have here?" and the other doctor said, "Heart attack, 5'9", 300 pounds, 32 years old." The doctor asks, "How does that happen?" The video shows Jim's life going backwards from his perspective till he was a child. It showed one day when he went for a checkup and the doctor said, "You're developing diabetes." The video showed the man at different times in his life and the junk that he was consuming. The video also showed the man's sedentary life and how he spent most of his time playing video games and watching TV. When he was a kid, the doctor told his mom that she needs to start doing something about his health before it's too late. His mom bought him a treadmill for his birthday, but he only used it once, and then it just became a decoration in the house. That is show when the child was a kid, the mom fed him junk food like fries when he would have meltdowns because it was the only thing that kept him calm. Now I'm going to show you what happens in the video.
Alright, what do we got?
Just came in. Heart attack. 5'9", 300 pounds, 32 years old.
How the hell does that happen?
Can I get a, could be developing diabetes. Here's an exchange. Oh, yeah.
You're graduating! Watch TV. You want to know sleep.
You can't do this.
Yes, can I get a...
No, deep dish.
You have to make a change. Good job, Jim. You got an A+. Here are your fries, sweetie. I still can't believe you get this child sexually exciting. I know. It's the only thing that'll make him stop.
This commercial accurately depicts childhood obesity and its effects. The video did not show a balanced presentation of good and bad aspects of the current health issue. It focused on mainly the bad because childhood obesity doesn't have any good aspects. Obesity is an illness and should be taken seriously because it has detrimental effects on a person's health. The video targeted parents and showed how severe childhood obesity can be. It also showed how important nutrition is for a child. Having a nutritious diet when your child when you're a child will benefit the child as they turn into adults. It can develop healthy eating habits and prevent them from developing other conditions such as diabetes and hypertension. Since Jim was obese his whole life, he was developing multifactorial disorder, which is when you have multiple medical problems that are associated with each other. The video showed how obesity will lead to long-term health effects such as heart attack at the age of 32 years old. It also showed the timeline of childhood obesity in Jim's life, from when he was a baby till he was an adult, and the effects that obesity had over that period of time. Lastly, the video did not indicate how parents can prevent their child from becoming obese. It showed that exercise and healthy food are important aspects, but there were no specific examples. This video was very accurate at depicting childhood obesity, so there was not much that it was missing.
Primary contact professionals. Prevention and maintenance for obese and overweight children begins at the primary level of care. Your primary contact professionals consist of medical, nursing, and allied health. The medical professionals include general practitioner, family doctor, medical doctor, school doctor, family pediatrician, primary care physician. The nursing professionals include primary care nurse, school nurse, practice nurse. The allied health professionals include dietitian, nutritionist, exercise physiologist, psychologist, and counselors. This method has been shown to have the greatest impact on children as it requires involvement of their family as well. For the children to effectively adopt new lifestyle habits, their parents need to be just as involved with the entire process. The children's primary contact professionals are then given the task of educating and counseling whenever possible to ensure their treatments promote permanent change in their patients' lives. These primary contact professionals must also collaborate with one another to ensure they have a similar treatment strategy and are working towards a common objective. With a health issue such as childhood obesity, it is imperative to analyze all aspects of the problem in order to find the best solution. Correcting negative lifestyle habits at a younger age will lead to overall better quality of life.
In order to comprehensively address the rising rates of overweight children across Canada, our federal and provincial governments must create a sustainable, multifaceted, and cross-governmental approach. Input from individuals, communities, researchers, industries, and non-government organizations can help mold policies in areas vital to the prevention and reduction of childhood obesity. Initiatives should focus on creating physical and social environments in which children live, play, and learn that are more supportive of healthy physical activity and eating habits. These should be centered around creating communities that support physical activity through both infrastructure and the built environment, and also improving zone legislation to increase access to nutritious foods. Food-focused education and literacy should be implemented and improved at schools, and availability of educational resources should be improved in other places as well. Changing behaviors involves enhancing physical activity in schools and shifting away from negative attitudes towards weight to more positive attitudes in promoting participation in physical activity. Provincial and territorial governments should interact with regional and municipal organizations to improve community designs and, along with the federal government, promote a multi-sectoral approach to build health-promoting communities. In order to obtain these goals, provincial and territorial governments should identify successful initiatives in their own jurisdictions and facilitate sharing with others. Initiatives to improve the availability and accessibility of nutritious foods should also be emphasized, especially for remote communities and vulnerable populations. Availability refers to the supply of food to a region or community, while accessibility refers to the ability of an individual or host to acquire the food. To improve availability, provincial and territorial governments should support community-led food assessments and food security initiatives. They should also promote civic participation in these issues through initiatives such as food policy councils, and engage with planners to implement bylaws and planning codes to increase accessibility of food. Efforts should also be made to decrease marketing of unhealthy foods that target children. Children are particularly vulnerable to marketing. Decreasing the exposure of children to marketing of unhealthy foods can aid in decreasing their consumption and allow for the promotion of healthy choices. Federal and provincial governments must interact with food and broadcasting industries, non-governmental organizations, public health experts, consumers, and academics to create common guidelines to decrease marketing of unhealthy food products. Conversely, there should also be efforts to make retail experiences more supportive of healthy foods and to promote healthy living habits. The prevalence of childhood obesity, as well as the progress of specific initiatives taken by individual sectors and levels of government, should also be closely monitored and reported on. This will allow improved understanding of which initiatives are most effective. Childhood obesity trends should be measured using indicators identified by federal and provincial governments, such as the body mass index and physical activity and eating behaviors.
In conclusion, current research has addressed the global health issue of childhood obesity, stressing the Commission to come up with a plan to present to World Health Organization to treat and manage obesity in children and adolescents. Healthcare practitioners will play one of the most important roles in managing this disease. A multifaceted cross-governmental approach that engages all relevant stakeholders will be necessary for the prevention and reduction of childhood obesity. And here are our references. Thank you for listening and have a nice day.